Good morning, good afternoon, good evening, wherever in the world you are. Welcome to the latest AD Talks. We normally meet annually in Marrakesh, but this year, because of the pandemic, we're coming to you virtually and at home or in your office, wherever you might be. We hope that you enjoy the next 90 minutes of conversation. We're going to be talking about the pandemic, saving human lives, or the economy. I'm John Yearwood. I'm a deputy editor at POLITICO in the United States in Washington, and I'm being joined by an incredible panel, many of whom, if you are a regular or if you've ever been to Atlantic Dialogues in Morocco, you may have seen some of my special guests who will be talking about some of these issues. I'm going to take a few minutes to introduce the guests, and then we'll get started to get more broadly to talk about some of the issues as it relates to pandemic and the economy. First, we'll start with Paulo Portas. Paulo served as Portugal's Minister of Foreign Affairs from 2011 to 2013, Deputy Prime Minister from 2013 to 2015, and Minister of National Defense from 2002 to 2005. A promoter of structural reforms, Paulo taught history of political thought from 1996 to 1999 and founded a university opinion polling center. In 2016, he became president of the International Strategic Council, a Morta Engel group with a focus on Africa and Latin America. He's also a member of the International Board of Pemex, Gas Mexico, and was elected deputy chairman of the Portuguese Chamber of Commerce in 2016. And you can find Portas on a television international politics TV program in Portugal, which he started some years ago. And he's a founding member of Vinciamo Consulting. We'll then now move to Andrés Rozental. He's a former diplomat and founder of the Mexican Council on Foreign Relations. He was Mexico's ambassador to the UK from 1995 to 1997. Deputy Foreign Affairs Minister from 1988 to 1994, ambassador to Sweden from 1983 to 1988, and permanent representative to the United Nations in Geneva from 1982 to 1983. He has had the lifetime rank of eminent ambassador since 1994. At his consulting firm, Rozental and Asociados, he advises multinational companies on their corporate strategies in Mexico and Latin America. Next, I'd like to introduce Jessica Gottelsben. She's the first ever elected ambassador of Running Start, a nonprofit organization that trains young women to run for elected office. In 2016, Jessica was honored at the 10th annual Young Women to Watch Awards in Washington, DC, as the National Political Rising Star Award recipients. Jessica is a 2016 graduate of the Women's Campaign School at Yale University. And in 2014, she was an inductee to the Order of Pegasus, the most prestigious and significant award attainable at the University of Central Florida, from which she holds 2 bachelor's degrees with honors and a leadership studies certificate. Next, I'd like to introduce Nchimunya Hamukoma, who is an economist and policy strategist based in Johannesburg, and is passionate about optimizing the conditions for human thriving. Her work focuses on understanding the policy building blocks of Africa's future and helping governments and organizations solve complex problems. During COVID-19, she worked with organizations to forecast the trajectory of the crisis, designing and dispensing a 5 million Rand food security grant in Gauteng. She's worked widely across the continent in Morocco, South Africa, Nigeria, Ghana, and previously led the research for the Brenthurst Foundation's Future of African Cities project. That's our distinguished panel, and as I mentioned earlier, over the next 80, 90 minutes, we'll have what I hope would be a robust discussion about pandemic saving human lives and the economy. As many of you know, COVID-19 showed how unprepared the health systems are to address major pandemics. Except for China, South Korea, and Japan, countries have struggled to deal with the pandemic, lockdowns, and quarantines, and have incentivized as a strategy. However, many countries have struggled economically and found out that a weak economy leads to a weaker healthcare system. Now, let's start by talking about, for a lot of people who are tuning in, might not be familiar with what the pandemic situation is on the ground where you all are, perhaps with a few exceptions. We'll start with Paulo, and we'll talk about the situation on the ground in Portugal, and you may want to also address the wider Europe.
Good morning or good evening, everybody. Thanks for Policy Center for the New South. We'll be back certainly to Marrakesh next year. And just to mention about Portugal, we are living in state of emergency, renewed each 15 days. We had bad phase out from the first wave and the difficult second wave, if we can tell this kind of scientific wording, because we just don't know who's starting second wave, who's starting the third one, or who's finishing the second. If you consider the European case, we have more or less 330,000 infected people, and we are among 6th, 7th in the ranking of European countries. It's not a positive rate because we have just 10 million people. So if you consider fatalities, we are in the middle of the ranking and in a better position. Just to mention, if I may launch two ideas. I got to what you said about South Korea, China, and Japan, and I would love to underline one thing. This is a global pandemic, but it is not a symmetric pandemic phenomenon. One thing is to be global, the other thing is to be symmetric. And if you consider the time of departure of the disease, the policy response, early or late decision making, the revamp of the economies, the kind of lockdowns, total or partial, and if you consider also economic sectors, this is not one single pandemic. There are many different consequences among continents and timings and economic sectors. So it's easy to understand that Asia was the first continent impacted, and then Europe, then Americas. But if you consider, for instance, economics, Asia is revamping globally better, obviously, but US is recovery is much more intense than the European one. So economic time is not parallel to the health care system. The second issue I want to underline is there is a big difference between countries with memory and countries who forgot or are just self-centered about this pandemic. Asia Asia had the memory of SARS 2003. In many countries, South Korea is the best example, changed the legal apparatus of state interference in emergency situations. So they didn't, they had lessons learned. One of the things it impresses me more, I'm not mentioning China just because we don't have for the moment enough transparent information. So I put it on one side. But if you consider that Taiwan, that knows very well China, cultural system, animal markets, culture, do you consider that Taiwan made the first tests in the airport of Taipei, the December 31, 2019 was exactly the day that the doctor, the ophthalmologist from Wuhan was writing in the social media in China, there is a pandemic, there is an epidemic phenomena. This is very similar to the flu of 2003. So the day we were very far from the recognition of an epidemic phenomena, China didn't communicate to WHO that you had human transmission. I mean, 31 December to 2019, Taiwan were based on rumors from mainland China, namely rumors from Wuhan. Taiwan was testing with a more generic test in the airport the passengers from the flights from Wuhan. That tells you something about early decision making. So the countries in Asia that were had a very were very quick, had a very quick reaction. Obviously, they performed much better. If you consider the following policies, South Korea didn't lock down completely. Taiwan didn't lock down completely. Even Singapore or Japan just locked down partially. So if you have quick decision-making system, you can perform better. That is and that is linked to the memory of previous pandemics. These countries know China very well. I just underline this factor. The second thing I want to underline and not and to share, there is a big difference between governments. You have to deal and decide among in a question in a pandemia where the unknown is for the moment more relevant than the known. That's very tough for governments, any kind of government. So obviously we know much more than we knew in March, happily, but you don't know how many waves, you don't know reinfections, you don't know the children contagious trend. You don't know about herd immunity. So many things you don't know. You have to decide among the unknown also. And the big difference, in my opinion, is between governments who respect science and listen science and governments who are impatient and don't consider scientific answers, even when they have no definitive answers. I know many times politicians are asking doctors and scientists, tell me, when can I open schools? And probably scientists sometimes tell us, we just don't know. We don't know enough. But there is a big difference, John, just to finish my initial remark. There is a big difference between rational and scientific, respectful governments. The best example in Europe is Germany, and it's not just a fact. Chancellor Merkel is a woman. Her roots are on on the scientific level. She has a natural dialogue with scientists. She was the person I know in the world with a better explanation about what is the R0 or why, or in the second wave, I have to close partially because I can't trace more than 75% of the cases. Okay, so you have governments with some rationality, respect and dialogue with science, and they performed, the trend is they performed better. And if you consider the 10 worst cases in the world, I mean, both on fatalities, on new cases, there is a very worrying conclusion. Or from those 10 cases, 8 have governments with populists from the left or from the right. And that's a matter to think. Populism is a simplification. A pandemic is very complex. We saw it in the United States, we saw it in Brazil, but we saw it also on the left populists in Spain or in Italy, with total disconsideration from legal order, from the ideology is always above and more relevant than public safety. So this is also a matter to think. We had governments with close relation with science, and science will be the weapon to overcome this situation, as we all know. And we had governments where, namely populist governments with no respect from the scientific advice. That makes differences when you can see the results. And by the way, I don't think it's also a fact of life that many women leading countries perform better than the masculine gender. Probably they are more close to facts and less close to utopias.
Well, thank you very much, Paulo. And I'm glad you mentioned women. We have two distinguished women on our panel, and we'll get to them in a minute to talk about not only what's happening in their respective countries, but also to get some sense from them of where we are economically and how we can help bring this pandemic to an end. But let's go next, though, to Andrés Rozental, because you mentioned, Paulo, about governments who accept or respect, who don't accept or respect science. And there are many people who might say, Ambassador Rozental, that might sound familiar, particularly in Mexico. So what's the situation on the ground in Mexico?
Thanks, John, and many thanks to the Atlantic Dialogues and the Policy Center for the New South for inviting me on this webinar. I think it's to some extent very appropriate that we're talking about this subject today, because the first vaccination was administered today in the UK to a 90-year-old lady. And so perhaps it's the beginning of the end of the tunnel, but just the beginning, because I think it's going to take a long time before vaccinations are available to the masses. I think a lot of what Paulo said applies very much to Mexico. I think at the outset of the pandemic, when I speak about the outset, let's say between December and February of this year, I think people in Mexico, including the government, were not particularly concerned, thinking that this might be just another SARS or another MERS, where it would not affect Mexico enormously. We had a very important experience in fighting a pandemic, which was the H1N1 virus, which hit North America in a very strong way. Unlike on this occasion, when the H1N1 virus appeared, there was a strong degree of cooperation between the three countries of North America Mexico, Canada, and the US, to immediately get the vaccines that were necessary, distribute them, and so on. Something which we haven't seen today with COVID. And perhaps we can discuss the issue of international cooperation in a second intervention. But to speak about what's happening in my country, we are one of the hardest hit countries. So the idea that this was an Asian problem, which was not going to come to North America, was quickly demystified around the month of March and April. We began at a very low rate of infections and mortality, but the curve kept climbing and climbing and climbing and climbing all the way until today, where we have over 1 million people infected and over 110,000 people who have died. But that is only according to official statistics. And there is a great supposition among scientists and even among politicians that the official statistics do not reflect reality, and that many more people are infected and that many more people have died as a result of COVID, partially in the case of Mexico, because many people don't go to the hospitals when they begin to feel ill. They stay at home. They may infect their immediate family. And if and when they pass, many of them are not counted as a statistic for a COVID death, if you like, for a viral death. So the situation is pretty bad. It continues to get worse. I think that very much like in the United States, we will be seeing further infections in these later months of the year and the early months of 2021. One of the things that's important to point out, and Paulo didn't mention this, but I think in one of the differences between countries that work on a federal system and countries that work on a national basis have a very different way of approaching this, mainly for constitutional and legal reasons. Mexico is a federal system. We have 32 states, and the states are, to a great extent, autonomous in questions relating to health, education, and other issues. And therefore, there are different approaches according to which states you are talking about. Some of our states have been relatively free of lockdown and of the worst measures to take against the pandemic, while other states have been at the forefront of the statistical numbers that Mexico has. The point that Paulo made about populism very much applies in Mexico. We have a populist president who at the beginning did the same thing that President Trump and President Bolsonaro and others did, which was to say this was nothing, this was another flu, and don't worry. The president of Mexico, has refused to wear a mask, face covering in public, very much like President Trump and President Bolsonaro. The only difference between the three is that both Bolsonaro and Trump got infected with COVID, and our president still hasn't gotten affected with COVID. Although I think there are a lot of people who wish he would, so that he would at least have the experience and learn about how this affects an individual. On the issue of learning and listening to scientists, I think we have a lot of scientists in Mexico, a lot of epidemiologists, and a lot of people who are very, very knowledgeable about infectious diseases. But the president, for at least the first 7 or 8 months, together with even his health ministry cabinet members, were frankly deniers. They simply did not understand the importance of the issue. They didn't foresee what was going to happen. There is a daily press conference in the evening where the Deputy Minister of Health gives the latest figures and shows graphs of the pandemic's effects. And up until just maybe 2 months ago, we were hearing every day that we had reached the end of the tunnel, that we had turned the corner, that the same thing that you've heard in the US, John and Jessica, I think there's a great deal of parallels, even though our president is presumably a populist on the left and yours is presumably a populist on the right. But the fact is that the same sort of denying political rhetoric was coming from the leadership of the country. And of course, that affects people. The normal individual in a large city like Mexico City sees that the president isn't wearing a mask, sees that the health authorities are poo-pooing the whole thing, saying that we've come to the end of the road, and so they don't wear masks, and so they get contaminated and infected, and so it's a vicious circle. And I think that we here, those of us at least who understand a little bit more about these things, I myself have been living at home and working from home since March. I hardly go out unless it's absolutely necessary. And fortunately, up until now, I've been healthy and in good shape. But other people, and especially in an economy such as Mexico's, where you have at least half of the population in the informal economy, of the economically active population, these are people who generally work on a day-to-day basis. They earn what they need for the day. And if you lock them down or if you close them down, don't let them work, they go hungry. And this is one of the big problems, and I think big differences there are between some of the more advanced developed economies in Europe, for example, and us. But it's not much of a difference when you look at the US, where these lines for food banks and people who really are in desperate need, who've lost their jobs and who don't have enough to pay their rent or to pay their food. This is one of the big issues surrounding the pandemic. I'll stop there.
Thank you very much, Ambassador. Some really terrific and incredible points. I'd like to move on now to Nchimunya. And before I bring both Nchimunya and Jessica on, I'd like to point out that they're both members of the Atlantic Dialogue's Emerging Leaders Program, which is one of the most innovative young leaders program anywhere. And they're often a very powerful presence at the Atlantic Dialogue's discussion. So both to Jessica and Nchimunya, welcome. But Nchimunya, let's start with you. Talk about the situation in Africa. I thought it was interesting that Ambassador Rozental talked about, as well as actually Paulo, populist presidents. I know in South Africa, you don't have a populist, but you have a popular president. So talk about what he has done down there and what impact it has had in South Africa. And also if you could touch on the situation more broadly in Africa. Thank you.
Sure thing, and thank you so much, John, and thank you so much to the Policy Center for the New South for inviting me to speak today. It's such an honor and a pleasure to speak with such an amazing panel of esteemed guests. So this is definitely much more exciting than my usual COVID programming. So thank you so much. And yeah, I guess so in South Africa, we really do have quite a popular president at the moment, because when we started out with the pandemic in March, as the numbers rose by June, July, South Africa was one of the top 5 countries when it came to infection rates with regards to COVID. And even as you were mentioning the numbers for Mexico and like for the US at around 1 million in terms of infections, we're not that far behind. I think we're something like 800,000 infections. But what the difference has been in the strength of legislation and in the belief in science. So we quite early on had quite a serious lockdown. We had a lockdown from the 27th of March when we had about 1,000 cases. And the lockdown was very intense and very brutal to the economy. The number of jobs lost were really significant, but it kind of shifted. So what it helped to do was to flatten our curve over time. So the number of infections that we've peaked at was much lower for our first wave than was initially anticipated because of the lockdown, and kind of put the country in a sense that we're going through a global crisis. We legislated mask wearing fairly early on. We had some, I think like some less popular and maybe not as effectively implemented curfews and social controls around the lockdown that didn't go as well because of the way that they were implemented. But I think for us, what's been clear, or what's been quite clear from the way that the government has handled it, is that like we're in a crisis, listen to the scientists. And so that means even though our infection rate is something like 800,000, our mortality rate is just over 20,000 people. And we are now starting our second wave. And it's interesting when talking to friends from the US, because like for us, what our second wave feels like is that the infection rates raised, and this is across the country, from about 1,700 per day to about 2,000. And they're now, I think, at about 3,000 or 4,000 across the country. And everybody is really concerned, and everybody is upping, I guess, their COVID awareness and their COVID responsiveness. But I mean, I think more broadly, when we think about, so there's two, I think there's two main points that I'd like to bring out about COVID. One is that COVID has been the great amplifier. And Paulo, I loved what you said when you said it's not a it's not a symmetric pandemic. That's the one. It's not a symmetric pandemic, in that whatever was going wrong in your society, whatever issues that you had, whatever was going right in your society, COVID has amplified those to the nth degree. So if you have a highly unequal society, which a lot of the countries which were facing really high COVID rates and high mortalities at the beginning were, like the US, South Africa, and Brazil, that came through very clearly. If your healthcare system wasn't one that could support the entire country, but only those with access to high levels of healthcare were the ones being treated, that came through very, very clearly. I think it's come through in terms of economic development. If we look at, like, there's been a couple of memes and tweets about Jeff Bezos and how much money he's been able to make through Amazon over this period. I mean, that comes through very clearly, that the current capital structures support that kind of wealth accumulation. So even though like the rest of the world is going through a very significant downturn and most people are quite economically stressed, because our economic system is so unequal, if you're at the top range, you're doing quite well for the most part during this time. And I think that's the thing about COVID. It amplifies whatever's in the system. And I think it's kind of, in some ways, there's an opportunity in that amplification for us to be able to see the systems for what they are and make a choice in terms of whether we'd like to continue perpetuating them or if we'd like to propose an intervention, which we had in the 2008 economic crisis, but we made a very different choice. So it'll be interesting to see where we choose here. And then another thing that is quite striking for me about COVID and thinking about like the continent of Africa more broadly is that like, so Africa has the lowest infection rates globally. With South Africa's 800,000, we are the majority of COVID cases on the continent. The mortality rates for the whole continent right now stand at, I think it's 25,000 for the entire continent, with 22,000 of those coming from South Africa. And it's really interesting because when the pandemic was coming out, people were like, oh my gosh, what's going to happen to Africa? Africa's going to be the worst hit. Like, what will they do? How will they survive? With, I guess, also quite like a less beneficent undertone to those nuances. But what's been really interesting is that even though the continent has performed so much better in terms of its health outcomes than anywhere else in the world, that's not really the story that we're talking about. And it's not really where we're learning lessons from. And the excuses or the reasons that people have come up with in quite like respected publications as to why Africa is doing well are frankly quite ludicrous. But it's interesting that like we're not using this as an opportunity to say, okay, so if this region that is one of the poorest regions in the world is able to prevent mass infections, because if the infections were at the rates that they are in other parts of the world, we'd have much higher mortalities to show for it. So like even if the testing rates aren't necessarily what people think they should be, the fact that the mortality rates in real time are what they are shows that there is something we're doing right. Like, what is it that we can learn from African countries in this instance with low capabilities, complex government arrangements, complex security contexts, understaffed and underserved healthcare systems, if those are the conditions that are providing us with the lowest infection rates globally, what's happening in the global north? And I think I'll leave it at that.
Thank you very much, Nchimunya. Let's go to Jessica. Jessica, let's talk about the United States. It seems to be the big elephant in the room here, where everyone is looking at a country that many people say didn't quite listen to science. What's the situation on the ground?
That's an understatement. The United States definitely did not listen to science. The state that I am in Southeast Florida. The state of Florida also did not listen to science. It has essentially become a thing that when anyone checks on me from around the world, even the policy center, when they send me emails, it's very much, we hope you're well and safe, because everyone is concerned that I might not make it to this webinar. The situation is dire and grave, and that is putting it nicely. I looked up numbers so that I would have them right now, and as of yesterday, in the county that I am in right now in South Florida, there were 792 additional cases and 10 more deaths, and that was considered a positive, good thing, because that meant that we went down from the numbers we had just 2 days ago, which is deeply concerning. On a personal level, I had H1N1 during that. And I am not someone who has a strong immune system. I am disabled. My mother is elderly. She's been in the hospital recently. I currently have a sore throat that I am monitoring. I've lost a lot of loved ones and friends and colleagues to the pandemic already. Every day I essentially get a new text or a phone call letting me know who's passed away. It's heartbreaking. I don't have the words. I really don't. It is heartbreaking to see a set of leaders that are so egocentric and so self-interested that it's promoted that culture in the United States. And I mean, everyone is seeing it. And that's, I really appreciate the sentiments that have been stated by my other esteemed guests here, because we really do have to focus on trying to get people back to thinking of evidence-based policy, science-based policy, decolonizing our systems, looking at inequities. The fact that we had our global health units within our Security Council disbanded early on, even before we came to this part of the pandemic, it shows how little we think of human beings. A lot of what I've been trying to convey is even the title of this, do we save human lives or do we save the economy? If that is our mindset, then we really don't understand like the value of human lives, the value of workers' rights and labor's rights. We keep defining people as essential workers, but these were the same people that we didn't care about their health care and the money for their families prior to this. We keep calling people frontline workers, but the fact that we use that language just means that we consider them sacrificial in a war zone. The fact that we say that we're having people on the front lines sorry, I sound a bit shaky because I'm genuinely concerned about the well-being of my family right now where I am in Florida and where we are in the United States. But just to put some perspective on statistics, within the last week, my state that I'm in within the United States reported more than 1 million COVID cases from the start of the pandemic. the state's death toll as of yesterday now stands at going on 20,000. Yesterday, this literally happened just yesterday. This is news for the rest of the world, in case you were wondering. The Florida State Police raided the home of the data scientist that was allowing us to know how many cases that we had. The Florida Department of Health, Rebecca Jones was working for the Florida Department of Health, and she was the one who was building our COVID-19 dashboard, and she was allowing us to have the data on how many cases there were. And our state government tried to have her manipulate the data. They did not want people to know. They wanted disinformation. They did not want people to know what was actually happening in our state. She refused to manipulate the data, and she went and created her own dashboard system to allow us to actually know what was happening in our state, because our leaders were refusing to do so. And the Florida State Police raided her home at gunpoint yesterday, took her computer system so that she cannot tell us what is happening. And they had her family and her children at gunpoint as well. This just happened yesterday. So our scientists and our data scientists are literally being intimidated through state violence, both with our local governments, our gubernatorial systems, our national systems. COVID-19 was the leading cause of death in the US this week, with over 11,000 going on 12,000. We've surpassed 14 million cases. You know, we're going towards 300,000 deaths as it is. It's likely that we're going to hit 500,000 by March 1st, and that's a very conservative estimate. On Thanksgiving, hospitalizations had hit 90,000 and 50 Americans were dying every hour. And I was worried about whether some loved ones were going to pass. That was my focus during, you know, a lot of people were having Thanksgiving meals virtually or traveling. It's dire. We've had 8 million Americans fall into poverty during this. And we have, you know, we've had our politicians sitting around saying, well, we're going to pass this federal CARES Act, which is going to have this one-time stimulus check that's going to go out, and unemployed workers are going to get more money. But unfortunately, this one-time stimulus was exactly that. It was one time. People cannot afford food, let alone going to the hospital. They can't pay their bills. We have, you know, these moratoriums that we're putting on evictions, and we're saying that, well, it's nice that we're not throwing people out of their homes. We should have never hit a point where we have to actually figure out a way to save people in this way. Part of the issue right now, literally this week, is that we have senators fighting amongst themselves in our congressional entities. We have senators fighting amongst themselves about passing a federal relief package. And part of the reason they are fighting and not getting passed, if they are doing their work at all, is that they cannot agree on whether or not to include stimulus checks. And economists are saying, well, will the stimulus checks really do anything? Let's just rely on unemployment systems. But if we rely on unemployment systems in the United States, we're leaving it up to local governments. That is a problem, because the governor for our state has intentionally, as I said, been going about disinformation. He has held on to money that was from the original CARES Act relief packages. It has been an endless state of politicians. We've had a broken unemployment system. People could not even utilize our unemployment sites to get their money. We have mass amounts of people dying who are incarcerated. We have immigrants who have been detained, who have been ripped from their families, who are dying because they are being exposed to this virus and not being able to have any safe conditions. And our government does not care. And it breaks my heart to have to say this, and I hope the world hears us, that our government doesn't care. The governor of my state was at a rally going into our recent elections. He was at a rally not wearing a mask. He made sure that other people didn't wear masks. I live in Southeast Florida, so I am near the beaches. I am near where people go, you know, to travel for spring break. I've been where we have our theme parks. Things were not shut down. The mindset was we have to keep bars open. People were out drinking and partying and the mindset was, it's not a big deal. The president of our country was saying, don't let this virus control you. And it is so awful that we have had to lose so many people, that what we're doing right now is stocking up in hospitals on tablets, digital tablets, so that people can say their last goodbyes to their families, because that is going to be their last chance to say a last goodbye on a tablet. And we've had to stock up in mass quantity because of the amount of deaths that we are going to have. And we should have never been in a spot economically that so few people have healthcare as it is. It sounds really great, but it's the truth. There's been a really poor job on leadership. There's a lack of care for human beings. There's a lack of care for science. And the mentality is, how can we essentially bail out those who already have the most? How can we bail out, and how can we provide more to those like, Jeff Bezos, this has been mentioned. How can we provide to those who are already fine and who already have access, when the majority of people of color, I live in a predominantly Black community and low income community, and a large part of even our neighborhoods are relying on bringing each other food from house to house, because we don't know how people are going to get fed. And it's constant ambulances going by and people being rushed to emergency rooms. And there has not been enough done. It's a mess. The nicest way to put it is it's a mess. I had a conversation with a colleague and a professor recently, letting them know that I may not be able to take my academic exams if I am taken to the emergency room within the next 2 weeks, because that's the reality of the situation, or if anyone in my family were to immediately pass. It has been, to put it nicely, a disaster. And I wish that we as a whole, in terms of the discussion we're having here, we need to think about this globally going forward. We need to treat crises, not just pandemics, but we need to treat global health crises as a whole as something that impacts everyone, and that we should each care about one another, that our governments should work together. So it is not who can get the vaccine first, who can make the most amount of profit, which government is going to have the most amount of money coming out of this. And instead it should be, if we all had just taken lockdown seriously, and if we put in proper economic systems that support the healthcare of people, and that we don't just tell them that your life only matters if you're productive. Your life is only mattering based on the amount of profit you can bring someone, rather than making sure that we all come out of this. And it's not the economy versus human lives. We don't have an economy without human lives. We don't have government without the people. And we need to get back to that we need to get out of this pandemic. We have to survive it. But when we get to our next global health crises, when we go through the climate crisis for that matter, we really need to take a look at how we value human lives and how we value each other on this planet, and how seriously we take science. Because I appreciate that there's been a mention of women and women's leadership. And I appreciate that what it looks like right now is that the Biden administration going forward has already been consulting New Zealand and, women in leadership in other places. Well, it's late. It is severely late. We can't get all of these lives back. And I, for one, am scared in Florida that we've had a scientist held at gunpoint and had her home raided just because she wanted to tell the truth. We have had journalists, and this stands for you, John. We've had journalists threatened for telling the truth. We have to live in a world and in a society in which journalists and scientists and those doing the work are valued. I am hopeful, and I am scared. That is the point that I am at, because we can't The United States cannot keep saying we are such a great country when this is what is happening. I hope we can decolonize our systems, as some of my colleagues have mentioned. I hope that we can look to women's leadership, and I hope we can make a lot of changes coming out of this pandemic. But I wish we had not been I wish our leadership had been better going into this and way before this year to ever put us at a point where we have to say, well, here are the lessons learned. We shouldn't have had to learn such deep lessons.
Thank you, Jessica, and certainly hope that you and your family members pull through this. And you know, we're pulling for you all.
Thank you.
I want to go to Paulo. Paulo, you're a former foreign minister. You heard what Jessica said. What was going through your mind? I think you need to unmute.
I share many of Jessica's feelings, and we all have the experience of losing someone close to us, and suffering and pain, and government errors and mistakes, even if I say when we are considering rational governments, in deciding in the unknown, it's not easy if they are rational and they try to do the best and they listen those who technically or scientifically know much more than they know. Okay, I want to underline this because I don't think you have just one government without mistakes, but there are many differences between governments with 100% mistakes or 50% mistakes. That's different. And that's different. Even if I should say, you know, Jessica, I'm in the west coast of Europe, and a very friendly country to United States, where we have many Portuguese descendants working and entrepreneurs. And I must tell you that on the economic side, first of all, Europeans have no moral authority to criticize America. Because if you consider fatalities, even in the most developed countries of Europe, with better social policies, you had a disaster. I will need some years to understand how France collapsed like they collapsed, where people pays more than 50% of taxes and have the right to wait an efficient system. On the other hand, I underline that on the economic side, it's very impressive. It's a matter of where you are and where you come from. I would love to have now in Europe the figures of unemployment of United States of America. United States of America is creating jobs since May. You had 14%. I remember the curve, similar to the Great Depression curve. You had 14% of unemployment in May. You are now close to 6.5. I don't know if it's the best works, the best opportunities. Probably they are very temporary. But if you just benchmark with European countries, you will conclude immediately that European economies are less flexible, less dynamic, and suffer it. You just have to see what will happen in this disaster 2020. The European economy will fall 8.4. The American one will fall 3.4. So if you see from Europe, things are a little bit more balanced on the economic side, okay? Then I want to underline what was said by Andrés. Buenos días, Andrés. Y qué placer escucharte. I was mentioning in Spanish, because I love a lot Mexico, and I have a lot of friends there. And he mentioned a very interesting point. I'm basically in the European sense a liberal. So I believe in federalism as a good solution to complex states. Okay, it was a liberal invention to put some degree of autonomy and agreement between federate states and central government. But this pandemic raised the question: when you have a global crisis, federalism is not enough, because you can't have, like in Spain, 17 different policies against COVID, or in United States, 50 different policies and non-policy in the central government. So you need a unique command. The militaries would say a unique command and a consensus among federate states to accept that unique command. I want to just give you a detail. In Spain, the autonomies, the regions, and the central government are not able to reach an agreement even about how to count fatalities. Spain has a huge reputational problem because their official number of fatalities is by far from reality. And that is a problem of disagreement between the Catalonians, the Basques, the Andalus, or the regions towards the central government. What I'm mentioning is just a problem. Federalism was a good internal solution to complex states. But if you bring federalism systems to global crisis, it's not good. It's not good because it divides authority. And by the way, Chancellor, good sources say that Chancellor Merkel, because Germany is also a federal state, half of her time per day, useful time, is consensus, commitment with the Länder, the federate states of Germany. And they rebelled against her in this last period of the second wave because she's more conservative in the sense she wants more effective lockdown, even if it's partial. And all the federated politicians from the left and from the right wanted to give good news and just good news, even if you are not able to give good news. Okay? The third thing I want our magnificent emerging leader and friend from South Africa. A big part of my professional life is in Africa, which is a continent I love. And I never accepted the condescending, typical European argument about pandemics in Africa. So for the moment, Africa is much more an economic and social pandemic than a public health one, if you benchmark with all our continents, with the exception of Oceania. And you can mention the typical argument from Europeans is, okay, but their informative systems, with the probable exception of South Africa and some others, is not so good. Even if this argument is right, what I also know is Africa, for instance, has more recent experience, memory of leading and dealing with pandemic phenomena. Just remember Ebola. So for me, Africa is a dramatic, cumulative situation of lack of remittances, because many African immigrants are unemployed now. It's suspension of investments. It's commodity prices in countries excessively dependent on oil, gas, or something similar. And also the temptation from developed economies to cut aid to development, because when you have that dramatic situation, you have to care about your neighbor and not your friend or brother who is 1,000 kilometers away, okay? So this is, for me, Africa for the moment is much more financial and economic and social problem, and the world has to do much more than World Bank and IMF has already suggested on debt relief. This will be a very critical problem for the next administration of the United States, for the government of China, who owns 50% of African debts. Don't forget it. And so my focus on Africa for the moment is much more the social situation and the economic situation, okay? And then I just want to maybe share a position which is probably not consensual. I listen many times the confusion between this is a global crisis and this is the globalization fault. I don't believe it. And that's why probably I'm heterodox on this issue. We'll need globalization and a regulated globalization more than ever when we revamp after the vaccine massive democratization, and we'll need to put economics in better shape and employment in better shape. We will need to sell and to buy more than ever. Globalization is, first of all, trade. It was the growth of trade that allowed the GDP global growth in the last 40 years. I want to remember 900 million people left extreme poverty because economies were opened. And this pandemic will leave at least 2 or 3 points more. So we made, it's a step back. It's a setback. We will have 2 or 3 points more again on extreme poverty. Where, if you consider the recovery of the economies, you will need more than ever trade and investment. You can do it in a global world. You can do it. You can't do it in nationalist, populist, and pure self-centered policies. So if you will need more than ever exports and imports. Sorry to say to those who want to criticize globalization, as I listen people saying this is the voice of the planet against the global leaders. Sorry to say, we had many pandemics in the past before globalization. Spanish flu. The difference is the badly called Spanish flu, because it was never Spanish. It was American, French, German, British, etc. And if some leaders like Donald Trump would have read some papers, at least some papers, they would know that the drama in the Spanish flu was the second wave in Latin America. It was not the first. If they knew something about history or about memory, okay? But my point is, what is my lesson learned when I listen some of my more, for instance, ecologist friends? Okay, there's no evidence, maybe one day you will have it, that there is a relation between the animal market in one and the non-ecological policies. It's much more a cultural question. It was 20 years ago and again this year. But what I know, and there we can have a good agreement, is this pandemic showed the world that we don't have an international crisis management system. So our problem is not less multilateralism, is more multilateralism. If you consider all the global organizations, we had WHO. You can criticize WHO, but imagine you didn't have even WHO, okay? So you will need much, my question is, at the end of this pandemic, we know it was the last one, but we'll have many others during the next decades and centuries. My question is, do we learn lessons like the Asians did because of SARS? And will we build a better international crisis management system, yes or no? Do we learn something with this or no? This is, for me, for the future, the relevant question. And by the way, if there is a good sign, I'm not sure that the competition to know who's the first with the vaccine was a bad or a good factor, because competition is in due limits very human. And what I know, you had the best example of international cooperation between universities, research centers, industries, and government stimulus packages to reach in less than 250 days what in normal conditions would cost you 3,000 days. I mean, predictable, we are not sure 100%, we are learning in action, but predictable vaccines. That was the best sign that you need global cooperation, global partnership, that you need industry, you need pharmacies, you need scientists, you need capitalists, and you need governments. So if you will have vaccines, and by the way, we are very used to criticize the West because we are free, but for some reason, you know nothing about the Chinese vaccines or even about the Russian. You know something. They jumped the phase 3, exactly the most critical phase of clinical assays. So you know nothing about Sinopharm, Sinovac, etc., because they don't go. It's interesting to, let this message. They don't go to international standards. It's easier to go.
So Paulo, I think you're making.
It's easier to go to the Chinese regulator than to the European one or the American. Okay, just to tell you this, it's if there is a good example of globalization positive side, it's what happened with science and industry in this question.
Great, thank you, Paulo. You make some really great points, and I thought your point on globalization was a very good one. And I wanted to go to Andrés, who's in a country that has benefited enormously from globalization. You've just signed a major, at least updated trade deal with the United States. How is that, you think, Andrés, going to help Mexico as it deals with this pandemic crisis?
Thanks, John. First of all, I'd like to say that I very much appreciate the talks that both Nchimunya and Jessica and Paulo have contributed to this webinar, because I've learned a great deal. I know that Jessica is in a particularly complicated situation, obviously personally, but also because she lives in a country, as do you, John, where frankly, it is almost incomprehensible what has transpired over the last 9 months, 10 months. If you had to do a Netflix series on this, you would really be somewhere between science fiction and total incredulity about how the richest country in the world, the country with the biggest economy, the country which has over so many decades and even centuries worked so hard to create the opportunities for all Americans in the United States and for foreigners who come to the United States who emigrate there, to have come to a situation where you have not only what's going on in terms of the pandemic, the number of infections, the number of deaths, but also the fact that you have people going hungry, people standing for hours in food bank lines trying to get basic food because they can't afford it otherwise. I mean, this is just really something that boggles the imagination, to be very honest with you. And I think it's not just Florida, it's California, which is probably right now suffering, one of the states that's suffering the most, but all 50 states of the United States plus territories, they're all in the same boat. And the same boat comes from the fact, and Paulo mentioned this very clearly, and so did Jessica, that the governments, whether they're state or federal, or in this case, international, multilateral, are just not assuming the responsibilities that they should. They are playing politics. In all cases, if you listen to Nchimunya, what's happening in South Africa is to a great extent political. What's happening in the US is also to a great extent political, and Mexico is no exception. I wanted to talk about two specific issues, John, which we have not really delved into before we end this webinar. One has to do with the question of human rights and freedoms versus decision-making by governments to help keep the population safe. After all, a government's principal, one of the government's principal tasks is to keep its population safe. And here you have this almost, I would say, ridiculous discussion going on about whether asking or obliging people to wear masks, obliging people to keep safe distancing, or obliging people to take a vaccine once the vaccine is available, is something which is also really quite incredible. You know, we all wear seatbelts when we drive in the cars. We don't consider that the mandatory use of seatbelts infringes on our human rights and personal freedoms. Because my human right and personal freedom ends where my neighbor next door, the person next to me, begins. And this discussion, which has almost come to the most ridiculous point in Brazil, where you have a president of the country who is a denier, who says, hey guys, you're going to die anyway, you might as well die now of COVID. And at the same time, you have a state governor in Sao Paulo who has made mandatory use of masks, made mandatory lockdown, and has made mandatory vaccination. Mandatory. You have to be vaccinated in the state of Sao Paulo when the vaccine is available, obviously. While as everywhere else, and in the US and in Europe and in Mexico, you have this story about, gosh, this infringes on human rights and it infringes on personal freedoms. And I don't want to be vaccinated because I don't believe in vaccinations, and I don't want to wear a mask because it doesn't allow me to talk or eat or whatever. This is just one of the big problems that we face today. And if we have anything to learn about how to deal with a pandemic, I think the one thing that is a lesson that we should all take home after this is over is that any global crisis, whether it's a global health crisis or a global economic crisis or a global military crisis, like a world war, requires a set of government decisions that need to be taken to save and keep the populations safe. You cannot abstain from doing that. It just doesn't work. You know, we mentioned the question of the WHO. Paulo mentioned it. What happened? We have an international organization that is meant to deal with global health issues, whether it's HIV, AIDS, whether it's Ebola, whether it's H1N1. And every time there's been, in recent times, a global health crisis, the first point of attack is the international organization. So when it was H1N1, I remember it was attacked because they said that the director of WHO was incompetent and didn't declare a crisis soon enough. The same thing happened now with COVID. And then the US walks out of the organization and says, you know, we don't like it because it favors China over us. I mean, it's madness. You create these organizations precisely to deal with global crises. And then when the global crisis arrives, the first thing you do is you attack it and say it's no good. And so what happens? Each country, each state goes on its own. And that's where we've come to this big problem. We now have vaccines which are being developed and almost ready for deployment. And instead of looking at a global plan on how to distribute these vaccines, we are all countries rushing to see who beats who gets more, who buys more, who is able to win the battle before the others. And that is going to be a big disaster, because there's no question that the countries that are the poorer ones in the world are going to be at the short end of that stick. The US has already decided who gets vaccinated. The UK has already decided who gets vaccinated. Mexico yesterday made the decision of who gets vaccinated when the vaccine is available over a period of time. But this is for countries that can afford to do this. What about all the countries in the world that can't afford this? How are they going to deal with it? So I think that's the number one.
Andrés, Andrés, thank you. And I know you had a second point you wanted to make, and I want to, hopefully we can come back to that. But sadly, we are running out of time. The clock is not our friend, and I appreciate this very good discussion. We have a little over 10, 12 minutes left. But I wanted to go to Nchimunya and ask you about how the U.S. is perceived in South Africa because of the way it's mishandled this COVID pandemic, and whether it's comments about WHO, comments about the vaccine, because the president is signing an executive order today, for example, talking about vaccines not leaving the country until the U.S. is sufficiently supplied. But what's the view from the Southern Atlantic about the U.S. At this point?
I mean, I feel like you've given me quite a tricky question to answer diplomatically. But I think I'll try. And I think it reminds me basically of when I grew up. So when I grew up, America was a place that everybody wanted to go. I remember whatever knowledge or information that came out of the States. I remember reading like Time magazines or Reader's Digest and like looking at American universities, and it was like, oh my gosh, America is this amazing place. And then 9/11 happened, and then that was quite confusing for the global consciousness, especially like watching the rhetoric that America communicated about 9/11, and then also watching the international media's rhetoric about what was happening and what was happening in the war on terror. And I think that after that, that left America in kind of like a gray sort of space as once ideal, but also complex and problematic. And with COVID, it's really, really interesting because it's just, if we think about US, what's the polite way to say this? US intervention globally in countries across the global South, and the amount of interventions the US has made on healthcare issues, on safety issues, on educational issues, where American money has been donated and put in across the globes, and the recommendations that have come across with them. It's very interesting to observe what America does when they're facing their own health crisis, and how a lot of the advisory that was given to developing countries is not the same advisory that's being taken at home. And also, I think something that's been quite shocking to watch from the global South have been like the numbers, and particularly in this past election in the US, the way in which the mortality rates weren't as shocking as they were for us from the outside. From the outside, when I saw that New York Times headline about nearly 100,000 lives lost to COVID, my mind was blown. I was so shocked that such a thing could happen, and more shocked that such a thing could happen in the United States with as many resources as the country has. And so it was interesting to watch in the election cycle and in the conversations being had about the election that the loss of these lives wasn't a key factor or a key swaying point or something that was, I mean, it came up, but it wasn't definitive. it was really interesting that this election wasn't definitive when you've had so many unnecessary deaths from COVID. And I think that's kind of, I can't speak for the entire Global South, but that's kind of the conversation that I've been having with some friends and with my colleagues in South Africa is, yeah, I guess we're a little bit taken aback that this is how this has been handled.
Thank you, Nchimunya. Jessica, I want to go to you again, and I love the way you speak from the heart, and I think that's really important as we look, because at its core, we're really talking about a disease that has caused a tremendous amount of lives around the world. How hopeful or optimistic are you about the future? I know you touched on President Biden coming in during your remarks earlier, but does that give you any hope for the future?
I mean, first, I want to comment. My other emerging leader colleague, she made a really good point, and I think everyone touched on this a bit, that the world seems shocked that what's happening in the US could happen. And it almost seems as though within the last 2 years, or even within the last 4 years, even prior to the pandemic, the world and a lot of the global South has said, wow, we didn't think this was possible in the United States. And I kept sitting here nodding my head because I'm like, I know that that's what you think. But for those of us here, this wasn't shocking at all. It is not odd to see the amount of lives lost or to see our leaders not care. That's just the truth. I am very hopeful. I am very hopeful in terms of the new administration coming in and what Biden and Harris are capable of. But a lot of that it's not just, oh, I believe in Biden and Harris. It's more so that we've been put in such a disaster that Biden and Harris have become like a sense of only hope for so many people. They have looked to, if we can have a change in administration, if we can have a change in policy, then maybe we'll have something. Because that is how hopeless everyone has been. That it seems like there's just this little sense of hope that we might get out of this. But long before this pandemic, human lives being treated as sacrificial. I mean, I can't comment for your opinions, John, and I won't. But for many of us in the United States, this isn't shocking. The things happening with our economic systems are not shocking. The idea that the health of so many people doesn't matter, that people can just be homeless and live in poverty and fight one another for food and for basic needs. It's not uncommon in the United States, and we need to dispel the notion to the rest of the world. I'm sorry to have to be the one to do it during this webinar, but just for everyone out there, there's a lot we can learn from Africa. And I'm saying this now, there's a lot that we can learn from the rest of the world. We are not these incredible superheroes. We shouldn't be put on a pedestal. And the things that you're seeing and the inequities that you're seeing, they are much more common, and I've been seeing it since childhood. Maybe the rest of the world didn't get to view it, but it's been happening in our states and in our neighborhoods long before this pandemic. And the pandemic is finally revealing to the rest of the world what many of us already knew. We already knew that this was the situation. And for those who are the most marginalized and the most vulnerable, this pandemic was just that additional sense of, if you are a Black, disabled, queer woman, if you're a single mother, if you don't have access to things as it is, your chances of making it out of this pandemic, it's not likely. And we knew that back in March. We all had this sense of hopelessness. So I'm trying to get everyone to hear that it is this scary, but I am hopeful. I am hopeful that we will actually have proper pandemic response teams, global health units. Just, I know that the next administration is going to be a lot better, but there's only so much we can do now with the lives that have already been lost. And I don't want the rest of the world to keep thinking that it wasn't possible in the United States for us to get to this point, that what they've seen in headlines was shocking. It's not shocking for those of us who have been here. And during the last election, John, you and I were at the 2016 Atlantic Dialogues, and I sat on a panel, and I had to smile and laugh through some statements that were regarding the United States' elections that had just happened. And I struggled to get through it because I had to restrict myself from saying on stage what is about to happen in the next 4 years is going to be detrimental and the whole world's going to see it. And to include a pandemic in that and a lack of leadership and a denial of science was something that I couldn't have stated while on stage, but we all saw that. And I am very hopeful. Like, I don't want to sound so much in fear. I am very hopeful. But I want the rest of the world to know that we can all learn from each other. Please stop putting the United States on a pedestal, because all of the lives lost, that should be what we look to in the future. We're not going to glorify our leaders. We're not going to say that we are immune to this kind of situation and to these kinds of tragedies and inequities, because there are so many lives that have been lost. There are so many people who don't know if 2021 will, with even all the hope in the world, they don't know if 2021 will be truly better if we make it through 2021. We have a huge mess to clean up, and we can't bring back the lives that we've already lost, not just from the pandemic, but from all of the other inequities that have only been amplified by it. So I hope that we will have more discussions with the Center for with the Policy Center and so many other coalitions and collaborations of organizations and civil society teams, and that people will listen to young people and women like myself and my other emerging leader colleagues, that there's so much we can learn, and we have to start. Sorry, I don't mean to get off track.
That's okay, Jessica. Unfortunately, we're out of time. But it's a discussion that I know a lot of people are having, and I certainly hope that we can continue the conversation when we all get together again, hopefully in Marrakesh next year. I want to take a minute to thank this incredible panel: Paulo, Portas, Andrés Rozental, Nchimunya, Hamukoma, and Jessica Gottelsman. Thank you all very, very much.
Thank you, John.
Thank you so much.
Thank you so much.